Uh, Thank you. Ladies and gentlemen, good afternoon and good evening and good morning. I'm Mr. Baekjuna, leading the Civil Health Bureau of Seoul Metropolitan Government, which is the primary responsibility of handling COVID-19 response within Seoul government. I would like to thank UNDP Seoul Policy Center and Director Klingebell for kindly inviting me to share Seoul's experience with COVID-19 with this global audience. Yeah, as the quote on the slide shows, my presentation today is based on the willingness of our mayor, Mr. Won-sun Park, to actively share the lessons learned from the response to COVID-19 with the global community to jointly address the current crisis. As you can also see in the graph on the left, we are now seeing a flattening of the curve in terms of the number of cases reported in Seoul. Our fight against COVID-19 is not over, and we are doing all the preparations we can to deal with a possible second wave, but we are relieved to see this positive trend. And I am proud to state that our efforts have been fruitful so far. Now I would like to begin by outlining key principles that underpin all the actions of the Seoul government in response to COVID-19. This is important. If there are not a clear guiding framework, policies are bound to lack directions. First, promptness and transparency. Built upon lessons learned from our painful experience to dealing with the MERS outbreak a few years ago. Seoul took the decision to swiftly and rigorously respond to current crisis from the beginning. We also applied the principle of maximum possible transparency in terms of information disclosure. This was our recipe, so to speak, to protect citizens' lives and contain the further spread of the virus. In our belief and experience, transparency of accurate and full information from the government prevents the circulation of fake news on COVID-19 and mitigates public fears in COVID-19 and enhance public trust in authorities. Next key principle is democratic participation. In Seoul's experience, fighting COVID-19 is not something that can be done top-down by force of the government alone. Without full engagement of citizens in all aspects of the social life, it is impossible to contain the infectious disease. In other words, citizens themselves hold the power to fight COVID-19, and it's our role as the local government to encourage, guide, and facilitate the citizens' effort. Fourth principle is innovation. Given the dynamic nature of the COVID-19 situation, rapid policy innovations were absolutely necessary. If we try to use the old instrument to fight new enemy, it simply will not work. So as the COVID-19 situation escalated in Seoul, we quickly adopted several innovative measures to scale up our testing and patient accommodation capacities. The fifth principle is cooperation. This means that Seoul cannot possibly do our job alone, but we must cooperate with the national government, other local governments at various levels, relevant public institutions, as well as with the private sector and community organizations. Now, cooperation is easy to say, but actually challenging to really do it in times of crisis. But without cooperation with others, we found that it's impossible to fight something like COVID-19. In the next few slides, I will now share just a few measures we have undertaken based on these 5 principles. given the limited time, I won't be able to introduce all of our policy measures, so please take this presentation as highlight only. The first is Seoul's COVID-19 information disclosure system. We quickly created a specific webpage to provide the most up-to-date, easy to understand, and detailed information on COVID-19 for our Seoul residents. The website allows citizens to access the latest list of confirmed patients' information, including their age, gender, date of infection confirmation, along with detailed information on the itinerary, where and when they visited after developing symptoms. The captured image on the right on this slide shows that Seoul has 624 confirmed cases with 2 deaths as of 20th April. We have also classified the number of confirmed cases by each district of Seoul as the image on the left. This allows the citizens to quickly access information in their location. To this day, the government is updating the COVID-19 dashboard on a daily basis. Next. Now, what is special about Seoul's website is the extent to which we are releasing the COVID-19 related information. Right from the beginning of the crisis, Seoul has been mapping the travel routes of confirmed cases and publicly release a specific whereabouts of them on our website. Such information is intended to enable residents to take precautionary measures and to monitor and report on their condition if they develop symptoms after having visited the places at the same hours as the patient. The information is updated several times a day. We also made a mobile application that provides the same information for convenience. In order to mitigate the side effects on business, we also decided to provide information about the nearest testing clinics and the clean zones. Clean zone means the place that have been disinfected after visit by confirmed patients. To assuage people's fears and encourage revisiting the business once they are cleared by the authorities. Next, yes. Next measure I am presenting is our innovative measure of COVID-19 screening and testing. As of 28th April, the total of 111,000 COVID-19 tests have been conducted in Seoul. To effectively deal with the rapidly increasing number of citizens to be tested, Seoul has mixed and matched all available testing technologies and have been quick to adopt innovative ideas to ensure safe and speedy COVID-19 testing. First, we have set up screening locations outside the public health center and hospital so that those who have COVID-19 symptoms can seek medical examination separately from general patients. Here, persons who are found to have contact with a confirmed patient during the screening process are immediately moved to a further isolated or separated area within the screening centers for sample collections. This system helps prevent secondary infection during the screening and testing process. As of 20th April, there are 62 designated COVID-19 screening centers operated by public health centers and hospitals in Seoul. And 58 of these centers have the means to collect biological sample of suspect cases. In addition, we adopted innovative measure of COVID-19 testing. You might have seen this on the international news already, but let me briefly explain how a drive-through testing facility works. In the reception, medical questionnaire is distributed to the testee. Only the driver is tested, and the vehicles with passengers will not be permitted into the screening stations. During the medical interview, the submitted questionnaire is reviewed Then the doctor checks the temperature, body temperature, and they examine the person in detail. After the testing, the test result will be notified via phone call or message within 1 or 2 days. The four steps take about 10 minutes with minimal contact between the testee and the medical staff. As of now, a total of 4 drive-through screening stations have been set up in Seoul, and there is a low risk of infection since the whole process is done in a single stop without having to leave the vehicles. As of 27th April, a total of 6,000 residents in Seoul have been tested in drive-through screening station, and among them, 6 cases have been confirmed. The next measure we adopted is called the Living Treatment Center. This was introduced based on realization that it is critical to categorize patients by their severity rather than hospitalizing every single confirmed patient. As the number of confirmed patients grew exponentially in Daegu, Gyeongbuk region, some patients with severe condition had to wait in their homes and even died due to the limited number of negative pressure rooms prepared to intake these patients. To prevent such incidents and provide more space for medical treatment for the neediest, the Seoul government quickly opened our living and treatment center. We used our city-owned facility and provided medical staff and support services 24 hours and 7 days. People are eligible to stay in this living and treatment center are COVID-19 patients with mild symptoms or no symptoms. People on the isolation period after being discharged from negative pressure room can also be treated in this living and treatment center. This way, we were able to accommodate all confirmed patients in Seoul while reserving the negative pressure hospital rooms for those with the highest priority. This slide shows the picture of Seoul's first living and treatment center, provided in the public facility for training and accommodation of national sports team and athlete. From 60th March, about 200 rooms in this training center have been converted into rooms for COVID-19 patients. Here, 1 doctors and 17 nurses provide medical services and checkup. As of 31st March, if those in these centers suddenly experience a severe symptom, the doctor can transfer them to a nearby clinic with negative pressure room for immediate medical assistance. Seoul government officials responsible for management of the center distributed personal protective equipment such as thermometers, blood pressure kits, and masks, and also distribute food and snacks door to door every day. Last but not least, Seoul has been implementing a rigorous public campaign so that citizens voluntarily adopt social distancing with the first lockdown of the city. As I explained earlier in the guiding principle section of this presentation, this is based on our belief that COVID-19 simply cannot be tackled without civic cooperation. In our social distancing campaign, Seoul used all possible public messaging channels and issued guidance to business, encouraging work from home arrangement. The 2-meter distancing and wearing of masks. Of course, we also took more forcible measures such as closing down certain public facilities and high-risk places such as cultural and sports facilities. But the public campaign was critical in our experience to create a new normal and to avoid the lockdown of the city. Let me emphasize, though, that the social distancing campaign and the citizen participation worked because of the other measures well in place, such as the transparent and full disclosure of the relevant information and the safe testing facilities which enabled a large number of Seoul residents to be tested and accommodated without delay. Now, this concludes my short presentation of Seoul's key message, and I will be happy to take a question from the audience. Thank you.